Hello, everyone. It's Darlene. I apologize to those of you who were expecting this video to come out yesterday. I had a little personal crisis with one of my fur babies that occupied my time, but I wanted to give this a adequate time to cover the topic. Today, we're going to talk about normal skin rashes, or I should say, common skin rashes in newborns or within the first couple of months of life. Um, I've made a list so that I would not miss any of them. I'm going to try to describe the rashes to you and tell you if there's any treatment needed or if you can just be patient and watch it go away. Okay. This is the most important thing to remember about most skin rashes in newborns is that they are self-limiting. And the ones that are not self-limiting, and what I mean self-limiting, they will go away with time on their own when you do absolutely nothing to them except for keep the skin clean. Um, on that note, I need to go back the last video I did on skin, and I was talking about bathing and not needing frequent bathing. Um, Baby newborn skin, you can bathe usually every 2 to 3 days. Sometimes you can go even longer, but on those days that you are not giving a full bath, you should really don't forget to clean the areas that become soiled. What I mean by that, your baby is drooling and eating and all that good stuff. So make sure you clean the face and the skin around the mouth and under the neck if formula is getting caught underneath there. Otherwise, you're going to end up with rashes due to irritation. You also want to make sure you clean the diaper area, okay? Because stool and urine, or feces and urine, whichever word you use, um, can both be irritating to newborn skin. All right, so I'm going to go through this list of rashes. I'm going to try not to go too fast, um, but fast enough that you're not bored. So, some rashes are common to all babies, regardless of ethnicity, and some rashes may be uh, more specific to babies of color. Um, so let's cover this. I was going to cover birthmarks also in this video, but I decided that it would be too much information. So there will be a third video on skin specifically covering birthmarks. Okay, let's get started. The first rash I want to talk about is the very, very common heat rash. Okay. Medical term for a heat rash is miliaria. Milia. I mean, RIA. Miliaria. Some people refer to it as miliaria rubra, meaning red. Okay. This rash you will find occurs in babies that are maybe a little bit um, exposed to an environment that may be a little bit too warm. You notice that babies don't sweat like we do, okay? So when they become warm, their their sweat ducts are blocked, and they can get this rash that looks like very fine red bumps. Sometimes they may not be red, they may be white, but the skin around it is red. um, this rash is self limiting, but it requires that you give your baby a clean and cool environment. Okay. So, heat rash is self limiting. Just cool your environment. Babies don't need to be excessively hot. If you're keeping the environment between 70 and 72 degrees, that's probably a good temperature for your baby. You do not need to overbundle your baby. That may lead to other problems, okay? The second rash I want to cover, some people refer to as milk rash. The medical term for it is milia, not to be confused with miliaria. Okay, milia is a rash that babies can be born with. It's a very fine bumps on the nose, maybe white or yellow in color. With this rash, you do not have to do anything. With time, the rash will resolve. Again, only recommendation is keeping the skin on the face clean. Okay, it will resolve on its own. The third rash I want to talk about is referred to by lay people as cradle cap. Okay, the medical term for cradle cap is seborrheic dermatitis. The most common area you'll find this rash is on the scalp. Most people are familiar with it being on the anterior part of the scalp, especially in this area over the soft spot, which kind of interferes with the appropriate treatment of this rash because people are to uh, afraid to do anything around the soft spot. Let me tell you right now, clearly, you will not injure your baby's soft spot unless you are intentionally trying to. Okay. Um, Cradle cap, although it's called cradle cap, can be found in other areas. It may be on the face, it also can be in the diaper area. Okay. Seborrheic dermatitis, what it looks like is white or yellow scales. You may have crusting associated with it. It is secondary to excessive oil production. Okay, excessive oil production. So, to take care of this, you must clean the area. Okay, even though, again, the the recommended cleaning of the skin for like a complete bath would be about every 2 to 3 days. When cradle cap is present, it is probably appropriate to shampoo the hair daily. Okay. And prior to shampooing, even though this is secondary to excessive oil production, to help loosen the scales, I generally recommend that you use either baby oil or olive oil and place on the scaly areas. Leave for about 5 to 15 minutes, and then shampoo with regular old baby shampoo. Now, it is important. Cradle cap can also be in the eyebrow areas, especially medially. I do not want you to put oil on the eyebrows so that it gets in the eyes, but you will want to use like a toothbrush, okay, and shampoo the eyebrows daily also. Okay, once again, if cradle cap is present, you want to shampoo daily. Prior to shampooing, you want to apply oil, let it stay for about 5 to 15 minutes. I would go closer to the 15 minutes. And what I forgot to say earlier is you're going to use a comb, like a baby comb, and you're going to lightly scrub the scaling, okay? Lightly scrub the scaling. You are not going to hurt your baby's soft spot, okay? And then you shampoo the entire head or hair, entire head hair, and rinse away from the eyes, okay? The next rash I want to cover is baby acne. Medical people refer to it as neonatal acne. Okay, so if you look at acne in babies, it looks almost exactly like acne in grown people or adults or older children. However, you don't get the cystic formation. So you're going to see papules, especially red papules, um, on the skin, and the you may see the it involves especially the face, the cheeks, the nose, the forehead. You may also see some on the trunk. Okay. The most important thing with baby acne um, is that you keep the skin clean. Okay. So I would just use a normal baby wash, and then lightly wash the face and remove the soap from the face. Do not leave soap on the face or residual of soap if you can help it because it can be drying. Um, Other than that, for baby acne, a lot of people have the question as to why babies have acne. And I think that you should think of it in this way. If you think about a teenager with acne, what's going on with a teenager is they have hormones that um, are fluctuating because they're going through changes, and then you have bacteria on the skin. Well, if you think about a baby, they were exposed to their mama's hormones, and now they're outside of the mother's body. So there's a fluctuation in the hormones. And even though there's not bacteria on the skin when a baby's inside the uterus or inside the womb, once you enter into the world, then thus you are exposed to bacteria. So it makes a happy home for the development of acne. But no worries, it's easy to treat if you keep the skin clean. My next rash I want to talk about is diaper dermatitis. And there are two forms of diaper dermatitis. The first one would be what I call irritant diaper dermatitis, and it is basically due to the contact of urine and feces on the skin. Okay. Now, it is important when your baby's diaper is soiled, whether it's with urine or with stool or feces, that you try to get that off the skin as soon as possible. Now, that does not mean you have to change that diaper every hour, but you do want to, especially when there's stool and loose stool, you want to clean that skin good, and remove that diaper. Um, if there is diarrhea, there's a couple of things that you want to do to protect the skin, because this is a very common time for you to get diaper dermatitis, especially on the buttocks and around the anus. So if there's diarrhea, and the definition of diarrhea is increased number of stools or decreased consistency of stools. So if you have very loose stools or watery stools, and remember, whether you know or don't know, stools in babies can be seedy with fluid all the way to Play Doh as normal. So if your baby is one of those babies that has the seedy, watery stools, then that baby you want to protect the skin. And the way you protect the skin is you use a zinc containing diaper cream. I'm not sponsored by any diaper creams, but the one cream that has been around almost as long as I've been in my practice, or longer, is Desitin. Um, it contains zinc oxide. If you can get just plain zinc oxide with no brand name, that's fine. But you want to put a zinc cream first, because zinc is necessary for skin repair. And then on top of it, you want to use something like either Vaseline or petroleum jelly, if you don't want to refer to a brand name, or A&D ointment or Aqua 4. Those three things, Vaseline, A&D ointment, Aqua 4, or greasy. And if you put something like that on your skin and you put water on it, what does it do? It beads up. It keeps the fluid up from being directly into contact with the skin. Okay. So the zinc cream helps with skin repair. The Vaseline keeps the urine and the feces from sticking to the skin and causing more damage. Okay. Now, the other form of diaper dermatitis is secondary to yeast superimposed infection, or most commonly Candida infection. Um, Yeast or fungus loves dark, cool, moist areas, and the perfect place for something to grow, such as fungus, is in a diaper area. Think about it. Urine is wet, feces can be wet, diaper area is dark, so perfect place for a fungus to grow, okay, or candida to grow. If your baby has a superimposed Candida infection, or what we call Candida diaper dermatitis, that needs to be treated with an antifungal cream. Okay, you can buy antifungal cream over the counter, such as Lotrimin, um, or you can seek attention with your primary care provider, who can write you a prescription for an antifungal cream and follow the instructions closely. My next rash I want to talk about is baby eczema, okay, or neonatal eczema, and some people refer to as atopic dermatitis, okay. Even babies can be allergic, and the skin, being uh, the largest organ of the body, can demonstrate allergies by developing eczema, okay. And it looks different in babies of color versus babies like Caucasian babies. Um, so don't uh, don't compare if somebody else has had eczema and it doesn't look quite like it. It still may be eczema. Okay. The thing about eczema, again, it is an allergic rash, and so there may be a genetic predisposition for developing this rash. But just because a baby has eczema as in the infancy stage does not mean it will continue to have eczema later. But there are chances, and not uncommon, that babies who have eczema when they're babies can also have eczema later in life. The difference is that as babies, the eczema may appear in different locations of the body compared to as an adult. Okay. The face is commonly involved in babies. And you may also see eczema. Um, um, you may see some on the neck, um, and on the trunk. Um, in some babies who have significant eczema, you may also find it on the extremities. Um, and when I say trunk, I mean chest, back, and also on the abdomen. So some babies may have pretty extensive eczema. Okay. Um, the way to treat eczema, because it is usually due to a moisture problem, is to there's a couple of things that I'm going to recommend, and I'm going to go through them in order of the way I wrote them so that I don't miss things. I'm going to look at my list. The first thing to think about is avoid the use of fragrances and dyes on the skin. And so don't use like fragrance baby washes like lavender baby wash, because lavender can release histamine, which can flare eczema. Okay. Um, it is important when you buy new clothing for your baby that you wash the clothing before your baby wears it. In clothing, especially new clothing, there are chemicals, okay? And those chemicals can irritate the skin and make the eczema worse. So please wash clothing before your child wears them. Yes, you need to try them on your baby first to see that they can wear them, but then don't leave them on your baby. Wash the clothing before you have extended wear of new clothing. The next thing is to moisturize the skin. Um, and you may need to use something like Eucerin or Lubriderm, just to name a few things to help moisturize the skin. Um, in these babies, you definitely don't want them sitting in water for a long time, because the longer you sit in water, the more dry the skin gets. So you want to bathe your baby as least frequently as you can and keep the skin clean. When you bathe, pat the skin dry versus rubbing the skin dry, because rubbing can aggravate itching. Okay. And babies who have eczema can have very itchy skin. You also can use something like Alvino and oatmeal uh, to help calm the itching. Some people just use oatmeal. Believe it, it works. You can put it in the baby bath. Just remember that it gets kind of thick, so you don't want to clog up your system, or wherever you're pouring at. You don't want to clog it up. So um, these are some of the things that I recommend for baby eczema. The next rash has a big name. Do not be fearful of it. It's called Erythema Toxicum Neonatorum, or ETN. It's a big name for a rash that is very self-limiting. Um, when it first comes out, it's you may see one or two spots, but then you may see lots of spots. It almost looks like flea bites. It's uh, usually a flat red base with a little bump in the center of it. The bump may be white or yellow. Um, and again, it is self-limiting. The only thing, keep the skin clean. And this rash will go away with no problems, leaves no scarring. The last rash, and erythema toxicum, you tend to not see it in premature babies. You see it in full-term babies. The last rash I want to talk about is called transient neonatal pustular melanosis. Okay, this is a rash that you find in babies with melanin. Okay, and it is a rash that is present at birth, but it can be in any stage of development of the rash. Okay, so of the rashes I've already talked about, there's only two of them that pretty much are present at birth. That would be the milk rash, or Milia, and now the transient neonatal pustular melanosis. With transient neonatal pustular melanosis, you may have a baby that's born that has these little bitty superficial pustules present at birth. Okay, and these pustules may be on the face, may be on the trunk, front or back, may be on the extremities, and also may be on the palms and the soles. Okay. Um, and because of that, um, don't get freaked out that it's something more significant. Okay. Once these superficial pustules rupture, and because they are so superficial, they will rupture. There is usually a pigmented spot or brown spot left behind, so the child almost looks like they have freckles. So the child can actually be born with the pustules already ruptured, um, and no pustules present, but just the little brown spots. And you think your child has freckles, but months later, the freckles have gone. Okay. They are not freckles. It is the transient neonatal pustular melanosis. There is no treatment necessary. It is self-limiting. It will go away on its own with time, and again over several months. Um, but in all of these rashes, the importance is keeping the skin clean and keeping the skin cool. Okay. I hope this has been very informative for you and not overwhelming. I thank you for your time of listening to me. And again, the next video I will do will be on birthmarks in newborns, or that you will see at least within the first couple of months of life. Um, Again, thank you for your time. If you have enjoyed this video, please give it a thumbs up. Please, if you have any comments or any questions that I can answer, leave a comment in the comment section. If you have not subscribed to the station and you are enjoying the information, please subscribe. And if you so desire, share these videos. I thank you again for your time. Um, have a great day.